Hi everyone, I'm Stephanie with 9Health. We're talking about something pretty important today. As we get closer to the end of the year, there's many opportunities to give, especially give where you live here in Colorado, to nonprofit organizations like 9Health. There's Giving Tuesday on December 1st, but Colorado Gives on Colorado Gives Day on December 8th. So I wanted to talk a little bit about that, what it is. I think a lot of people don't know that 9Health is a separate 501c3 nonprofit, so I want to talk a little bit about that as well. And just where your donation goes when you support 9Health. We have some important programs for community health, and our goal is to make everyone healthier, and our mission is prevention. So I'm joined by 9Health CEO Gary Drews and 9Health expert Dr. Kyle Coley. Wanted to bring them both on. Gary obviously can offer the logistics of where your donation goes, and Dr. Coley can talk a little bit about the importance of the programs that 9Health provides and why it's important that we keep providing those programs. So first, Gary, I'll start with you. When people think of 9Health, they think of 9 News. We were, born from 9 News, but we are a separate 501c3, like I mentioned, nonprofit. Talk a little bit about that and how 9Health is funded.
So yes, 9 News did start 9Health back in 1979. It was so successful. Over 50,000 people came to the first health fairs in 1979. It was so successful that it spun off into a nonprofit in around 1987. So ever since, we have been, as a nonprofit, reliant on the little sliver of revenue that comes from lab screenings. Many of you know, if you've been to a health fair, we're able to offer a lab chemistry screening for just $35, which is about 1/10 of what the marketplace is charging for that same thing. And so 9Health gets a little piece of that $35 that funds our organization. As you know, the pandemic has had an impact on public gatherings. And so we unfortunately had to cancel all of the health fairs back in March. And we spent the summer reformulating how to get screenings to people. Because if we can't run health fairs, or at least a lot of them, we did manage to run a few. But if we can't do that, it's imperative that we continue bringing preventive screenings to the public now more than ever. And so we do get a portion of our operations funded by donations. And it's a really valuable time to consider giving to 9Health to help, one, make sure that people still get preventive screenings. And I think Dr. Coley will talk in a minute about the importance of that and the impact, but it also enables 9Health to bring new services to the community, such as telehealth, which we're quickly working on to be able to provide preventive health screenings and care to underserved populations across Colorado.
And Dr. Coley, Gary mentioned it a little bit, but it's important, especially now that we're the healthiest versions of ourselves. Prevention especially is important. Talk a little bit about prevention. We want everyone to be super healthy. Give your pitch for preventive health and why the screenings that 9Health offers are important.
So I would say 2 main reasons why now more than ever prevention is so important. The first is that we're in the midst of a pandemic. And one thing we have learned is that those that are not healthy going into the COVID-19 infection are the ones that are at the highest risk. So chronic medical problems like diabetes, hypertension, obesity, really herald a significantly higher risk of complications and of dying from COVID-19. So diagnosing those now, knowing that we're going to be in this mode for the next several months and managing them, getting them under control to really optimize your chances against the virus, I think is more critical than ever. But the second reason I think is more of a bigger philosophical reason. And if you look at medicine and the interventions that appear to have the most impact, it is the preventive interventions that we do. So when you're in damage control mode and you're trying to treat diseases that have already occurred or have already manifest themselves, it's a lot more difficult to really use those medications or use treatments to impart a change. On the other hand, if you find a disease very early, or you can prevent a disease from occurring, you can really have an extremely dramatic impact on the course of that person's illness with just a tiny bit of an intervention. So I think prevention has such a dramatic footprint when it comes to managing medical problems that if you can really catch the disease early or prevent it altogether, that is almost a surefire way of ensuring a better outcome.
Yeah, for sure. She summed it up pretty well there. And Gary, you talked a little bit about this already, but tell us more about how those donations are used that come into 9Health. What programs does it fund? How does it help us move forward?
You bet. So every donation, every dollar is, I would say, priceless in a sense. I think of some of the folks that do not have access to care right now very easily, let alone preventive screenings. And so we're on a mission to help make those things more accessible. And so, for instance, I was asked recently, what does $1 a day provide to 9Health if we gave that kind of donation? And my answer was, well, right off the bat, 10 folks are able to get the lab screening that Dr. Coley just mentioned. And out of those 10 folks, almost 4 of them are going to find out that they're pre-diabetic, and almost 7 of them are going to find out that they have high cholesterol. And if you don't act on those things, it's pretty powerful impact on both certainly your health, but also livelihood and family and so on. The other contribution that is really valuable to folks, especially now, is that for every $100 donated, we're able to provide telehealth to somebody for a year, unlimited telehealth primary care. And so that is obviously pretty important for folks that either live in an area that, believe it or not, many areas of the state do not have medical providers. This enables folks to short circuit having to drive a long way to an emergency room for something when they can in fact ask a doc for less than $100 for a year's worth of access. So those two things I think are pretty compelling, and that's how we're getting our services out into the community at this point, thanks to donations.
And we've talked a little bit about, obviously 9Health has affordable preventive screenings. We had the fall 9Health fairs. We had to cancel them in the spring, but we figured out a way to offer a fair safely in the fall, and we did that. If you missed those, you can still get your preventive screenings done at Quest Diagnostics Patient Service Centers. Go to 9healthcare.org. I can put the direct link in the comments. Sign up for those. But Dr. Coley, if people want to go sign up for screenings, they're looking at all the offerings that we have, what are the screenings you suggest people get right now?
So some of the screenings really depend on your underlying medical problems, but for most average adults, it is a really good idea to get a lipid screening because you want to get a sense of your lipid health. And remember, lipids are determined by 2 factors, your diet and your genetics. So even if you're a healthy eater, even if you're thin, even if you're exercising a lot and in shape, it's still important to get those lipids checked. The second is the hemoglobin A1C, because the incidence of prediabetes and diabetes in the United States has continued to increase, partly due to the obesity epidemic, but partly due to the types of foods that we're eating and the lifestyle that we live, where we're all extremely sedentary. So that's another test to know what your average blood glucose control was over the past 3 months and whether you might be at risk for progression to diabetes, because prediabetes is not going to create symptoms, neither is hyperlipidemia. And both of those conditions can obviously significantly impact not just your cardiovascular risk, but as Gary said, your quality of life. Even, you know, if they end up manifesting as a stroke or a heart attack, it could have a significant impact on your quality of life. And then for certain select adults, depending again on, you know, risk factors, a TSH or thyroid stimulating hormone might be a good idea if you put on weight, you're feeling sluggish, you're feeling tired, because as we get older, a lot of people can have thyroid glands that just kind of tire out. That's called hypothyroidism, and they're just not generating enough of that hormone. And that's an easy fix. And it really does obviously help you feel significantly better. A sleep apnea screening is a good idea, and you can go to our website and see there's a number of different surveys available that you can look at and see. And then finally, most average Americans are vitamin D deficient. Again, a function of how much time we spend outside, you know, the fact that some of us are darker skinned, and the fact that we're consuming certain types of diets that all contribute to vitamin D deficiency. So that's another good test to check if you think you may be vitamin D deficient.
And just to follow up on that, we've talked in other segments about this, but checking vitamin D, checking some of those things, seeing if you are at risk of prediabetes. Those are also helpful to know if you get COVID and how your outcome might be if you get COVID, right?
Exactly right. Yeah, there's many different factors that can influence how you do with COVID. And certainly those types of problems can impact your course with COVID. We haven't yet figured out if it impacts your susceptibility to COVID, but it may actually even have a role in making you more susceptible potentially to COVID. Another interesting factor that seems to have an association with COVID outcomes is your blood type. And that's another test that 9Health offers, and certain blood types have a lower association with COVID mortality. And the reason for that is because our blood cells are part of our immune system. So, the blood type, it basically is just a marker for what type of blood cells we have. And those are all part of our immune system. And that's thought to be the reason why certain blood types may be associated with lower risk of COVID complications.
Yeah, and as Dr. Coley mentioned as well, there's some screenings you can do on our website that are kind of surveys. There is one for diabetes, sleep apnea, heart health, nutrition, stress. You can take those surveys online for free and see where you stand. If you're not really ready to leave the house or not ready to go to a patient service center, see where you stand and see if you need any follow-up or need to get some blood work done. Gary, you talked some about this, some of the programs we have currently, but for those donations that we're going to get, you mentioned telehealth. What are some of the things we're working on? What does the future look like for 9Health?
So we have found in talking with the communities around the state and with a number of leaders that the combination of being able to provide preventive screening, like Dr. Coley's talking about, along with preventive health education, which you're a part of, Steph, and Dr. Coley, that effort is necessary to really understand the impacts of something like COVID and the like. So this very effort that we're trying to help educate the public about the importance of prevention during a pandemic is really vital. And so we're always stepping up our efforts to do that. And then the third piece of the puzzle is to provide access to preventive care that is really necessary to keep understanding what may show up in your own results and what to do next. I think one of the big gaps for all of us right now, and I think about the number of folks that are avoiding care for both obvious reasons, but also psychological ones here, it's pretty important not to avoid care. And so if we can make it more accessible through telehealth and help you know what to act on and how important it might be, that's really the valuable handoff back to doctors and providers across the state so that it can be followed up on. The easiest way to do that is, a buy one, give one. Get yourself over to a Quest lab and get yourself tested, but bring someone along with you. It's an incredibly generous gift to somebody to learn about their health.
Yeah, it's a perfect idea for something to give as we head into the giving season. Give to 9Health, but go give, to your neighbor, to your friend, and get screened as well with your neighbor or friend. Dr. Coley, Gary was mentioning it, and I'm just kind of adding to some of the stuff I gave you guys when I told you what we would talk about today. But he's talking about, the number of people avoiding care right now and avoiding preventive screenings. Can you talk a little bit about some of the latest data on that and what implications that will have moving forward?
Yeah, a lot of this data is coming from the cancer literature, and what we've seen is a dramatic decrease in the number of new cancer diagnoses. And that's not because cancer is going away or because people are not getting cancer, but it's primarily because people are not getting their cancer detected. And cancer is a great example because it really is the difference between life and death. So a cancer detected earlier in stage 1 can be cured and treated so that you don't have to ever have it again. Whereas a cancer detected later in stage 3 or stage 4, once it's spread to the lymph nodes or other parts of the body, can be very difficult to treat with a low survival and a very high mortality. So, given that the pandemic has gone from being just a few weeks of this to now presumably, several months with several more months ahead of us, my best guess when we're going to be out of this is going to be 2022, when life is completely back to normal. It really is not an option to continue to avoid that preventive care. And if you're somebody who's high risk, then telehealth or televisits are a great way to connect with your healthcare provider to try to understand what types of screenings you need. If you do need to go in for an imaging test, you can take certain precautions, double mask, wearing eye protection, being really mindful of what you're touching, those types of precautions to minimize your risk of spending very little time in there. and get those screenings done. So I think, prevention is not something we can put off any longer. And I think prevention is probably going to have the biggest impact in terms of morbidity and mortality, because we're going to have those people that got the infection and recovered. And once the vaccine comes, that'll all flatten out. But the wheels that have been set into motion with these missed diagnoses, with missing the preventive screenings, are going to last for decades and decades to come.
Yeah, so it really is important, just check in on your health. It's $35 to get a full blood chemistry panel from 9Health, which is, a drop in the bucket. It's really affordable, and you can get that done at Quest Patient Service Centers, which are all across the metro area. And Gary was even mentioning, we're reaching out to rural areas. We're going to start providing some telehealth services. Dr. Coley, just really quickly, we've talked a little bit about this, but before we go, we've mentioned telehealth a few times. For those that aren't really familiar with that yet, because the pandemic started, providers were kind of thrown into telehealth. Even if they were kind of dabbling in it already, they had to start providing that. So what is telehealth? What will that look like for someone if they want to go that route?
So telehealth is really the use of online or virtual technology to have an interaction with your healthcare provider. And it really is quite broad. In fact, not only does it encompass video technology, such as what we're doing now, so FaceTime, Zoom, Microsoft Teams, or other HIPAA compliant platform that your provider may use, but it also encompasses phone. So if you're talking to your provider on the phone, that could be considered a telehealth visit. It encompasses text messages as well. So that type of an interaction with your provider. And in my opinion, every cloud has a silver lining, and the silver lining of this pandemic has been the ushering in of the telehealth era, because telehealth has really revolutionized the way that we deliver care to our patients. It's improved access, as Gary said. So we are now able to monitor our patients much more closely than ever before. It's facilitated, frequency of interactions because of lack of issues like transportation and, office staff. And so it's reduced the cost of delivering that type of care. And then, for me as a provider, I've really enjoyed the fact that telehealth allows me to actually look into a patient's home. It's really almost akin to when we used to do home visits decades ago, when doctors used to go to patients' homes. It's a great way to connect with them, really understand their social situation, and really kind of meet them where they are and provide them care over there. So I feel like telehealth has been a real boon. If you think you might want to have a televisit, almost all practices are providing that now because of the COVID-19 numbers. Just call your doctor and request that your in-person visit be changed to telehealth, or request a telehealth visit. Usually you do require the need of a smartphone or a tablet, as well as a stable internet connection. But as I said, it can even be done over the telephone if you don't have access to those. So really lots of different ways to take advantage of this great option to interact with your doctor and make sure you're staying on top of your preventive care.
Yeah, and if you're someone that's lost your job, you don't have insurance, don't have a doctor, Dr. Coley mentioned, if you do have a doctor, call and ask for that telehealth, telemedicine visit first before having to go in. But we have our 9Health Neighbors line, which is staffed by 9Health medical volunteers. You call, leave a message. Within 24 hours, someone will call you back. You can talk to a real person about all your health concerns, mental health, physical health, whatever you want to talk about. The number is 303-698-4455, extension 2005. I'll put that in the comments as well. But again, we still have our 9Health Neighbors line going. So use that. Also use the free screenings at 9healthcare.org. And then if you need to follow up at all, we offer those blood screenings at Quest Diagnostics as well year round now. So don't have to wait for health fair. Go whenever you want and get your blood work done. And that's all we have for you today. I'm going to sign off from here. Thanks, guys.
Thanks, Steph.
Thank you.